Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome to this episode of Family Practice. I'm Dr. Jeff Fox. Tonight we're going to talk GLP-1 medications for weight loss, both injections and pills, and we're going to update you. Also, it's springtime. Kids are out playing. We're going to talk about control of their allergies and summer safety. Also, do you have thumb pain? It might be arthritis, and we've got a new procedure for you. All that and the bedside nurse, the backbone of healthcare, is here with us tonight. But to start us off is Dr. Leticia Dirks, who is a pediatrician with PA&A associated with Lexington Clinic. Welcome.
Thank you. Thanks for having me.
All right, now I mentioned springtime and allergies. Is it going to be a bad season, and what can we expect?
Yeah, I joke with my family sometimes that I love Kentucky, but we tend to have bad allergy seasons. So, it seems like kind of an inevitable part of the springtime. It seems like we're already starting to see some of those symptoms pick up in patients. So I've started to talk to families about restarting their allergy regimens if they haven't already.
So you talk, we've got pollens, we've got grasses, and then we've got freezes, and then we've got pollens and grasses again. So what are some symptoms that might say, okay, this is an allergy?
Yeah, typically with allergies we're seeing things like, a runny nose that's persisting, like itchy, watery eyes, sneezing, sometimes coughing, or like drainage in the back of the throat that can cause a little bit of a sore throat as well. In more severe cases, like when we talk about things like food allergies or severe environmental allergies, can progress to symptoms suggestive more so of like anaphylaxis as well. And those are the more scary allergy situations where we see things like nausea, vomiting, trouble breathing, and typically an emergency condition that gets handled in an ER kind of setting.
Well, let's start with the simple stuff. What can you do to manage allergies even before you get to the doctor?
Yeah, that's a great question. We do a lot of kind of allergy management with over-the-counter medications, which is nice because there's a lot of options out there. Typically talking about things like oral antihistamine medicines are kind of the first line treatment for allergies. And those are things like Zyrtec or Zysol or Allegra. And then also incorporating things like a nasal steroid spray as well, so something like Flonase. Oftentimes with allergy management, we're doing a combination of those two things, and depending on the person and how they respond to it, maybe making adjustments to those medicines. But we see a lot of families in office to talk through, how can we optimize our allergy regimen or make changes to make things a little bit better when they do seem to pick up this time of year.
How about environmentally? Are there things non-medication you can do?
Yeah, I think being aware of environmental exposures is a big part of it. So, if you know that you or someone in your family is allergic to dust mites, like trying to limit that exposure in the household can make a big difference. Doing things like using a washable mattress cover can also add some benefit from that perspective. If there's any kind of like animal allergies, trying to avoid exposures in that way as well can make a big difference in symptoms.
And now a little bit more severe side is like immunotherapy and even EpiPen anaphylaxis. So when is it they should see an allergist or consider something like that?
Yeah, I think we do a lot of the kind of day-to-day management of allergies in the pediatric realm, but I typically think about referring to an allergist if we're having trouble controlling someone's symptoms despite being on a good regimen, or if they're having kind of recurrent issues come up because of the allergies. So things like recurrent upper respiratory infections, recurrent ear infections, or recurrent like eczema or asthma flares as well that may be driven by those underlying allergies. We often will refer to allergy as well if there are a history of those more severe, like anaphylactic type of reactions.
Real briefly here, summertime also brings swimming, and drowning is big in kids as a cause of death. What do we need to know about that?
Yeah, I think water safety is such an important part of our job as pediatricians, and it's something that I try to bring up to families when they're in my office. I think having an adult whose entire responsibility it is to supervise children when they're near water is really important. I also try to remind families when they're in the office to think about things like swimming lessons and young kids who are learning to swim, just to make sure they have some of that swim safety and some survival skills if they ever were in an accidental situation. And I always remind families too, I know we have some great lakes here in Kentucky, and if you're spending a lot of time out on the open water, we really want to make sure you're wearing a life jacket and being extra prepared from that perspective, just in case anything happens.
Well, thanks for the care you give our patients. Thanks for coming in and talk about it. We really appreciate it.
Thank you.
And when we come back, we're going to talk about GLP-1 and weight loss.